As you know, we've had a spike in cases in the state of Mississippi over the past several weeks. And, it is my prayer and hope that we can hold off for several more weeks here in our community um, until we can make sure that we look at our numbers and make sure that we have a downward trend of the spread of the disease in Natchez Adams County. I was on a conference call this morning with Dr. England, and he concurs that we need to look at our numbers up until around the 21st of June uh, before we, begin to talk about opening churches in our community. So at this time, I'm going to ask Dr. England if he would to speak to this matter. He's the chairman of the task force for the city of Natchez, and he's also a specialist in infectious diseases. So, Dr. England, if you don't mind.
Sure, Daryl. Thanks, Daryl. I first wanted to share with you a article I read just in the last 2 weeks, and what it is a epidemiologic predictions on which way the virus may go in the United States or even worldwide over the next 2 years or so, 2 to 3 years. And because this gives the background of the scenario we're talking about and what we're going to have to deal with. This was put out by Michael Osterholm, his epidemiology group at the University of Minnesota Medical Center, and is not different from other scenarios that I've read. He envisions three possibilities. One, the initial epidemic, which we have gone through here and are on the declining side in Adams County. We still are getting cases at the hospital, but not like we were 3 to 4 weeks ago. Compare that to Jackson, who's going through their surge right now. When I was talking with Dr. Risa Webb, infectious disease at University of Mississippi on Friday, she told me they had 85 ventilators going, and that's just at university. Be many more at St. Dominic's and also at Baptist. So two different situations of those two cities, but the three scenarios that are envisioned are, once we finish this initial pulse that we've gone through now, is the constant slow burn of cases over the next 2 to 3 years until either a vaccine arrives or we develop what we call herd immunity, where there are enough people in the population, say 60%, that are immune to the disease, having had it, so that the other 40% are reasonably safe. The second scenario would be an ongoing series of waves like we've just had. So in this scenario, and we're trying to anticipate the behavior of people, and you know how unpredictable that can be. But in that scenario, as each wave ends and people want to get out, then new exposures occur, and then there's a subsequent wave. And people go back into isolation until that wave passes, and then the cycle keeps repeating itself on for the next 2 to 3 years until enough people are infected for the herd immunity. The third scenario is a mimic of what happened 100 years ago during the Spanish flu, in which there was an initial wave in the spring of 1918, and we're in the spring of 2020, and then a follow-up wave that's enormously worse than the first wave, and that occurring in the fall and winter of 1918, 1919, or in our case 2020, which would dwarf the wave that we've had now. And in 1919, that's when the majority of the deaths and millions of deaths occurred. After that, being a much lower level of contagion after that second tsunami type of wave. So this is what we're having to deal with and what we're having to predict through. And my suggestion to Daryl was, we've now gotten back together. Route 61's open. The various restaurants and some of the businesses are open. My thought, it takes about 5-6 days for somebody who's exposed to become infected, and then usually 2 or 3 weeks to become ill enough to go to the hospital or the doctor. And I'm thinking this is May 21st. If we give it 4 weeks, we'll have some idea of whether we're going to have a second follow-up wave based on relaxing social isolation. And at that point, we could make some kind of call as to whether it's safe to go back into the churches. Now, understand that down the line, there's probably going to be more isolation episodes because of the nature of the virus. The virus dictates everything here. It's there. It's not going away. It's going to be part of our lives for the next several years. So that's what I communicated to Daryl. I would think we could make a better call 4 weeks from now than we can right now. I can follow what cases are coming into the hospitals, and we can get statistics on the number of new cases that are being identified in the lab, and then make a better call for y'all. And I think, in my mind, everybody wants to know, is it safe to do this or not? Nobody wants to be the church in the national news that where the outbreak erupted again. And you just have to have some kind of idea that of where the cases are and what they're doing. Ideally, we would have more testing involved, but for whatever reason, the country's never been able to get that mobilized as yet. So we're going to have to go by numbers of cases at the hospital and identified in the laboratories. So that's what I communicated to Daryl, and I think that gives us the best margin of safety. But we just have to realize we still have to be careful even after that. There will be transmissions going on in the town for a good while, and there will be follow-up waves coming in which it might be necessary to go back to virtual church services or whatever way we want to handle that. I would support watching to see how things go over the next 4 weeks. And by the time we get to a month from now, we ought to have some idea of whether we're going to have another wave through here because of reopening businesses and restaurants. If we can see another wave coming, my advice would be to hold off on church services at that point. If there's no wave, we have an ongoing low-grade spread or cases coming in, then I think we could say, yes, let's give this a try and have the church services. 4 weeks from now, we'd be in a better position to make some sort of prediction about the future. Back about 3 or 4 weeks ago, we had a very intense wave here at the hospital. We had 9 ventilators going, which is a lot for us. And now we have 1. Well, in fact, we just extubated somebody, so we have none on the ventilator, but we do have cases in the hospital. Now, at that time, when I looked on the per capita caseload, we were twice as active as Jackson was at that time. It's probably well reversed at this point. These things go through in waves in various areas. Whichever city's next, we don't know. We're tracking the virus and making our best guesses. For some reasons, the virus may go somewhat dormant. There'll never be a total lack of cases, but it may not transmit as actively as it was, say, a month or 2 or 3 ago. But down the line, the best predictions of epidemiologists are we will have waves going through. Over the next 2 or 3 years, there will probably never be a time where there's not some sort of transmission going on in Natchez and Adams County. What will distinguish certain times are times when there are waves of a lot of cases and then troughs where there are not so many and just kind of a low-grade transmission. So I think when the idea comes to open, it would be with the idea of separating as best you can, like you're seeing people do, the 6 feet and the and you may want to go to the masks and just realize that as a wave comes through, it's going to be safer to shut down until the wave is over. And the waves will come, as the best predictions I've seen. They may magically go away, but that's, as a psychiatrist say, magical thinking. In about 2 or 3 years, there ought to be enough immunity to really open up the way we want to. Or if some vaccine comes along, which I wouldn't hold your breath regardless of what people say. I know the world record for vaccine development is 4 years, and that was for the mumps virus. There will be a lot of people working on this very intensively for a vaccine, but they've worked too for 40 years on the HIV virus, and all the cash has been poured into that, and there still is no vaccine. And the sister virus to the COVID-2, the COVID-1 virus, it had an epidemic 18 years ago, and we still don't have a vaccine for it. So I would be pleasantly surprised if a vaccine comes along. But until then, we'll have these periods of low-grade transmission and probably waves. There are tests available, but none are FDA approved, and I would hesitate to make any judgments about myself if I went and got a test. I would wait for something that's Food and Drug Administration approved. I know of a physician who had the virus and went and got an antibody test afterward and had no antibodies, and that doesn't seem plausible to me. Good decisions. I said to the newspaper a couple of days ago, we're opening businesses, but we lack the testing to make sure all the employees are negative on testing. And if somebody comes up positive, the owner of the business can tell them to go home for 2 weeks and come back. But we don't have that kind of testing. I mean, they moved that into the White House once they started getting cases so that they can operate. But the rest of us would need that to be absolutely sure about opening up businesses and such. So that's why I told the newspaper best to just continue, use the masks when you can, avoid touching your face, avoid anybody coughing. That's why I'm saying too, wait for 4 weeks or a month and just see what happens with this. We're going in somewhat handicapped on it because of the testing and lack.
And that's my position as mayor of the city, is to urge all of the churches, let's hold off for about a month. Let's look at our numbers. Let's follow this disease in our community, and at that point, make a decision in terms of allowing our congregations to come back to our various churches. So that's what I'm strongly urging the ministers to do.
The reason I'm saying this is if we wait 4 weeks, I think we're in a better position to predict the danger of having church services. If we see a wave coming, it's just better not to do it. Wait till the next wave is over with. If I were talking to a group in Jackson, Mississippi, I would say hunker in and let's meet back in a couple of months. They're going through a big wave right now. There's just no good, really safe way to handle that. So it's going to devolve down on individual communities and meetings like we're having right now, and some judgment about what the virus is doing in that community in that time. It's going to be one situation here, another situation 90 or 100 miles away. So we're in the position of having to judge the waves. And we're in a position now where if we wait 4 weeks, we can see what the opening of the community and of the businesses does to the cases of the virus. If it's not rising, then I say let's go ahead and give it a whirl. And then we can watch down the pike because there will likely be other waves further along, particularly in the fall. And just be ready to, you may well have to suspend these services another time, even if we get going now. And that's just for safety's sake. If we have a big wave in the fall and in the winter, it could well be chaotic. I'm basing a lot of what I say off of the 3 predictive scenarios put out by the University of Minnesota and Michael Osterhelm's group, epidemiologic group. But there are other scenarios being put out that are very similar. What we're having to deal with is a virus that's unknown to us. We don't have a good past record of its behavior. We can only look at other viruses and how they've behaved in the past, and then we have to turn around and predict how people are going to react to that. And predicting how people are going to act, I've found to be inherently, you can predict some things, but others it gets very hard, and so that's what these scenarios are, basic predictions based on what we know about this virus, what we've known about similar viruses in the past, and what we know about human behavior.
If we have another major wave because of the relaxation of what has been put in place, retail, barbershops, beauty shops, restaurants, if there's another major wave, there is a possibility that there could be another shutdown, which we pray that won't happen. And that's why, today, because the governor has relaxed retail, he's relaxed restaurants, he's relaxed barbershops, beauty shops, fitness centers. We don't know what's happening currently with the virus in our community. And that's why Dr. England is suggesting that, we hold off until the 21st of June to see what's going on in our community as it relates to the spread of this virus.
What numbers would need to be in place for a green light after 4 weeks?
I don't think that that's possible to state. It's going to be, if we had the testing that we need, we could probably put that down and give you a number, but it's really going to come down to a general sense of how many admissions are coming into the hospital, how many positive tests are being seen by the State Department of Health in this area, and if we're starting to see a big climb out because of the fact that we have businesses and restaurants opening, then there's probably going to be a warning at that point. Look, you better wait a little longer to start up.
Dr. England, thank you so much for all that you do for our community. And thank you for being on this call.
Anytime. Thanks.